Hi, I'm Azara Tagaya, your host for Ringgit Sense. As the cost of living steadily rises, one of the many things that has gone up in price is the cost of medical care. In today's episode, we explore how much it really costs to take care of yourself and your loved ones in trying times and how the consumer is really affected. Before that, though, we speak to a few people to find out what they think about the rise in the cost of medical care.
Okey, bagi pendapat saya lah, kos perubatan pada masa kini memang bagi saya memang meningkat lah, dapat rasa lah berbanding dengan dahulu. So untuk apa beza perkhidmatan di hospital kerajaan ataupun di hospital swasta, bagi saya memang hospital swasta tu memang tak tipu, memang mahal. Tetapi servisnya cepatlah berbanding dengan kerajaan. Bukan apa, sebab bila hospital kerajaan kosnya murah, orang ramai akan berduyun-duyun pergi kat situ. So itu menyebabkan mungkin servisnya lambat lah. Bagi saya, bab kata pepatah Melayu lama, sediakan payung sebelum hujan, ataupun kata lebih baik mengelak daripada mengobati, kerana orang kata kalau kita takut untuk berhadapan dengan kos perubatan yang tinggi, lebih baik kita mengelak penyakit itu sebelum dia datang kat kita dan dengan adanya kos perubatan yang tinggi ni.
Well, there you have it, some views on the rising cost of medical care. And to speak more about this topic today in the studio, we have with us Dr. Ravindran R. Naidu, President of the Malaysian Medical Association. Hello, Doctor.
Good evening.
Hello, thank you for joining us.
My pleasure.
Okay, so talking about the rising cost of medical care, first up, what do you think is the main reason for the medical care rising, and what are some of the biggest complaints that you've received from maybe doctors and also patients?
Well, one of the reasons is the ringgit against the US dollar. And since we have, the ringgit has gone down tremendously in the last couple of months. And to say that we have also the economic problems, where the economic scenario is quite different now compared to a few years ago. And so because of this, we find that medications which are brought in from overseas and even raw material for our generic drugs are all increasing in cost.
Okay, so what are some of the biggest complaints in terms of the cost of healthcare that you received from patients?
Oh, the biggest complaint is increased cost.
Okay, so just increased cost.
Increased cost in the private sector. And because of that increased cost, there is a shift of patients to the public sector. Okay. Last year, it was reported by the Ministry of Health that there is a 30% increase in patient load in the private sector and the public sector.
Okay, so can you give us examples of how much of a percentage in increase it's been, and some of the more popular procedures which have seen a significant increase in cost?
I think almost all procedures have gone up across the board. If you're talking of private hospitals, I believe the ward charges, procedures, everything has gone up. But one thing that I would like to stress here is the doctors' fees have not gone up, because the doctors are controlled by what you call the Private Healthcare Facility Services Act and the 13th fee schedule in the, for the specialists. And for the general practitioners, we have what you call the 7th fee schedule. So therefore, the doctor's fees as such has not gone up, but overheads, price of drugs, staff cost, electricity, and all that has gone up.
Okay, what about the equipment? So with the rising costs of medical care, do you see that the equipments have been improved as well? The care has been improved for the patient?
Yes, definitely it has been improved. Okay. Because nowadays with the latest technology and the latest improvements, there has been an improvement. Okay. But unfortunately, with that comes a cost. Example now, GST. Now there is GST on many of the instruments, so that definitely increases the cost.
Okay, so there's this sort of trend or a way that some consumers are trying to reduce the cost is by relying on just generic medicines. So do you think that can work as well?
Generic medicines are very good, provided there is good quality control. Some generic companies do produce very good quality generic drugs. So the patients going on to generic drugs is no problem at all.
Okay, so can you give us examples of how exactly the rise in cost of medical care actually affects the consumer directly? Say, for instance, childbirth. How much would it cost in a public hospital and how much would it cost in a private hospital?
Okay, in a private hospital, this childbirth, there are several different types of packages they have. It can range from 5,000 to 7,000. Some can even go up to 10 for a normal delivery, which means they just get in on the day with the pains and probably discharge the following day. In a public hospital, is very cheap because for patients, they just pay 3 ringgit a day for third class, and they can have a delivery, no problem at all.
I see. But are they using the same equipment, though?
Yes, it will be the same equipment. May not be as sophisticated, but good enough.
Basically.
Yes.
Okay, so that's about the basic rising costs and the reasons behind that. Well, we're going to take a short break, and when we come back, we're going to be talking about more about the cost of medical care, and we want to find out more specifically how it affects hospitals as well. Back on Ringgit Sense after this.
Okey, kalau kos perubatan dekat hospital kerajaan, kos dia tak adalah tinggi tapi harga dia boleh tahan lah. Contohnya macam 500 lebih kos warded, tapi kita dapat subsidi. Contohnya dapatlah kurang dalam 100 lebih. Tapi untuk proses, contohlah kan, macam hari tu mak saya warded, dia dimasukkan ke ward biasa, tapi kita nak minta dia ditransfer ke ward kelas pertama atau kelas kedua, itu mengambil masa. Dan juga agak sukarlah untuk kita yang tak ada GL ni. Tapi dari segi servis tu alhamdulillah lah okey. Dan kalau dari segi hospital swasta pula, kos tinggi tapi servis yang cepat. Itu beza dia. Dari segi rawatan pula saya rasa kerajaan lebih bagus sebab dia sangat detail. Dia daripada satu penyakit ke satu penyakit, dia akan cuba cari apa punca sakit sebenarnya. Cuma dari segi rawatan susulan tu mengambil masa lah. So kalau dari kos saya prefer kerajaan lah. Cuma dari segi warded semua tu itu je lah yang masalah sikit.
Some views from Malaysians there on the rising cost of medical care. We are still talking to Dr. Ravindran R. Naidu, President of the Malaysian Medical Association. And Doctor, before the break, we spoke about the basic rising costs and some of the reasons behind that. So now we want to know, how has the rising cost of medical care actually affect hospitals in general in terms of the care, the equipment, the staff, the doctors?
Well, all the rising cost has obviously affected, especially the private hospitals, because what has happened is, with all the rising costs, patients have to pay much higher compared to before. And therefore, what is happening is now, because of that, many patients are moving to the public sector, to the government hospitals.
I see.
And also to add on, some of the simple ailments, the patients tend to treat themselves. They buy the drugs in the pharmacy and they treat themselves, which is quite a concern, actually.
Okay, so how will these sort of procedures taken on by the consumers themselves to try and treat themselves?
Procedures, no. They can't do procedures themselves. However, just conservative treatment, like, for a fever, cough, then they can buy the medications from the pharmacy.
They just take whichever medicine
Whatever,
they can get.
yes, that's right.
Okay, so how do you see this affecting the consumers?
Oh, well, this is not very good because if it is a simple ailment like upper respiratory tract infection, okay, they can treat. But we are worried what else. There could be more to it than just a normal fever and cough, which consumer will not be able to identify. And that is why we advise them to see a doctor, whether be it in the public or private sector.
I see. But coming to that, on trying to treat themselves, so to speak, some people for them, it doesn't just boil down to costs. Some people are afraid to come and see the doctors for fear of not afraid of knives or blood or anything. They're just afraid of hearing what they don't want to hear. They might be suffering from something, so they try to alleviate the symptoms, so to speak, by taking more vitamins, medicines. What do you have to say to these type of consumers?
Well, as long as it's nothing major, it is no problem. But if they find that they're not responding to the treatment that they're taking, it will be advisable that they see their doctor immediately. The fear of seeing a doctor, of course, many people do have that. Better not to know than to know what you have. But these are not unavoidable. And if they go to the doctors early, they can be treated rather than go beyond a time when, it's not treatable.
Yes, true. Okay, so the MMA has recently stated that many private clinics have closed down. So what's your take on that? Why is that?
The last 2 years, we estimate about 500 clinics having closed down. The reason being they don't have enough patients, and therefore they can't sustain because of the rising cost. I mean, to operate a clinic in KL, the rental itself could be something like 10 to 15,000 ringgit. Now with the staff minimum salary, cost of drugs going up in price, so everything is becoming difficult for doctors. We recently did a survey on 1,800 doctors, and it has been found that only 60% of the GPs are only seeing about 30 patients a day. And at 30 patients a day, definitely they're going to find it very difficult to sustain with such high costs.
How is the government actually taking care of the standard of public and private hospitals? And with, the Healthcare Act, does clinics and doctors have to actually modify their type of equipments or their premises to comply with the Act?
Well, with the Private Healthcare Facilities and Services Act, there are certain criteria which we have to follow. Even in clinics, the size of the room, the size of a door, what are the instruments, basic instruments that we must have. All these are laws which we have to comply with.
Okay, what about the cost of drugs?
The cost of drugs, well, many people, they buy generics, which will be not too bad. But again, like I said, the cost of drugs have gone up, maybe between 10 and 20% now.
I see.
So everything has gone up. Unfortunately, our consultation has not gone up. So to get back the consultation, you see, like in the Private Healthcare Facilities and Services Act, our consultation for general practitioners is fixed under the Schedule 7. As for specialists, under Schedule 13, it's also fixed. That means they cannot charge more than that range that has been given to them.
I see.
It's not that a doctor can charge as and how much he wants to charge.
I see. Okay, so it's all based on, it's a standard, actually.
Standard, exactly.
Okay,
Yes.
so when we come back, Doctor, we're going to talk about the upcoming budget and what's in store for the consumers and also the trend of the rising cost of healthcare. We'll be back on Ringgit Sense. Don't go anywhere. Coming back after the break.
Okay, bila kos perubatan meningkat sebenarnya beri banyak kesanlah kepada kita, sama ada secara kepada mereka yang ada pendapatan maupun yang tidak ada pendapatan, kerana kita tahu bahawa kos sara hidup sangat tinggi sekarang ni, jadi macam-macam yang perlu kita fikir dan sebagainya. Bila kos perubatan meningkat, ia memberikan kesan kepada mereka yang tidak mempunyai insurans ataupun pendapatan tetap. Saya okey kalau kos meningkat sekiranya fasiliti dan juga alat-alat perubatan akan dipertingkatkan dari segi mungkin kapasiti ataupun dari segi penggunaannya. Macam saya sendiri, biasanya saya akan pergi ke private hospital lah, kerana syarikat saya menawarkan kemudahan insurans. Jadi kita pun prefer kepada tempat yang mempunyai fasiliti yang lebih baik dan juga kita tak perlu tunggu masa yang panjang untuk melakukan sesuatu pembedahan ataupun check up. Jadi saya rasa ia memberikan kesan, tengoklah pada keadaan sama ada kepada mereka yang ada pendapatan tetap ataupun maupun mereka yang tidak ada pendapatan tetap.
That is what some people think about the rising cost of medical care. We're still talking about it here on Ringgit Sense with our guest, Dr. Ravindran R. Naidu, President of the Malaysian Medical Association. Doctor, welcome back.
Thank you.
Now, we are now talking about medical care and the rising costs. So for the upcoming budget, what is your sort of wish list?
Well, healthcare costs will definitely rise. It'll continue to rise and probably faster than inflation. Okay. Now, the wish list is actually, I think the government has to come out with what you call a national healthcare financing in order to alleviate all these problems that are being faced by not only the doctors, but also the patients. Okay. The second is we would like the government to remove GST on healthcare, total removal of GST on healthcare. That is our wish list.
I think that's something that all the consumers would like as well.
No, what we are saying is for health being the priority for the people of the country. And I think we must make health affordable for our people. Therefore, things like GST and all that should be taken away so that we can try to make it more affordable.
Okay.
For the people.
At the moment, can you tell us how GST is actually applied in healthcare, in which specific areas?
In private hospitals, they charge GST. In general practice, we are what you call GST exempt. We don't charge GST. However, many items that we purchase, we have to pay GST. So, for example, now if I have an X-ray for the films, I have to pay GST. Investigations, blood investigations, I have to pay GST. And instruments, I have to pay GST. And having said that, this GST having been charged to us, we can bear maybe a certain percentage, but part of it will have to be passed to our patients.
I see. So the wish list for the upcoming budget, remove GST and also a national healthcare
financing.
All right.
Yes.
Okay, so with the trend of the rising cost in medical care, how do you see this trend in the coming years? Will it continue to rise, and in which healthcare areas specifically?
Oh, it'll definitely rise because healthcare, I think, globally has been rising. But it's only a question of how we are going to contain the rise. As for the government, we hope the government will increase the budget for the public sector so that more people will have access to medical care. And along with that, many of them who go for treatment now, for example, if they have to put in a plate, they have been asked to pay for it or buy the implants and all. So with an increased budget, we hope all this can be taken care of.
Okay. Which areas of healthcare do you think would be most affected? Would it be for the common cold or for more complex procedures?
I think it'll affect across the board, even for the normal ailments as well as more complex. I think the complex will cost higher, much more, compared to the common cold.
Of course, significantly. Yes. Okay, so what would be your advice to the public on how to...
Health is very important. Take care of yourself, exercise, eat healthy. I know Malaysia is a haven for food, but I think we need to be careful with what we eat. To avoid being obese, because if we should land up with chronic diseases like hypertension or diabetes, and if we don't take care, the complications can be more severe.
So that's on how we can actually prevent by taking care of ourselves.
Yes.
But how do we manage the rising costs for the future?
The rising costs, that's what I said. If we are taking care of ourselves, we have a healthy lifestyle, exercise, maybe we fall sick less.
Okay. And maybe we won't need to worry about the cost so much.
Yes.
Okay, thank you so much, Dr. Ravi, for sharing with us on Ringgit Sense.
Thank you, Azalia.
Thank you. Well, guys, that's all the time we have for today. Now, to watch the videos from today's episode, the views from our audiences, go to our Facebook page, Ringgit Sense TV3. Next week, we're going to be talking about something else that is also rising in costs, which is the cost of higher education. We try to find out the answer to the question, how much should parents save for their child's higher education? I'm Azara Tagaya signing out, and I will see you next Monday.